Hello, everyone. Thank you for joining our session. I just wanted to introduce our speaker, Hannah Huang, who's Assistant Director of Pharmacometrics at the Cognigen Division of Simulations Plus. And today she's going to be discussing pimavanserin exposure and QTC interval in patients with schizophrenia.
Hi everyone, good afternoon. My name is Hannah Huang. Today I'm going to share with you an example of exposure response modeling using QTC data in patients with schizophrenia. Patients with schizophrenia that are on more than one antipsychotic may be at a higher risk of QT prolongation. And pimavanserin is a serotonin receptor modulating agent, and it's being developed to treat negative symptoms of schizophrenia. In a previous study, pimavanserin was found to increase the corrected QT interval by an average of 5 to 8 seconds. In this analysis, data from two clinical trials, the ADVANCE and the ENHANCE, were pulled to investigate the potential effects of pimavanserin on QTC. In these two studies, the pimavanserin was administered in addition to the patient's background antipsychotic treatment. The objective of the study is to develop a exposure response model to characterize the impact of pimavanserin exposure in the presence of selected antipsychotic. So a little bit background information on the two clinical trials that were pulled. The clinical trial ADVANCE was a phase 2 clinical trial in adult patients who's been diagnosed with schizophrenia for more than a year and had predominant negative symptoms while on treatment with an antipsychotic. ENHANCE was a phase 3 study in patients with schizophrenia that had inadequate response to an antipsychotic treatment. Patients received either placebo or 20 milligram of pimavanserin once daily in the presence of background antipsychotic. After 3 weeks of dosing for ENHANCE or 8 weeks of dosing for ADVANCE, the the doses of pimavanserin were allowed to be adjusted to 34 milligram or lowered to 10 milligram daily. Oops, sorry. For both trials, 12 lead ECGs were collected and centrally evaluated. For ENHANCE, the ECG was collected at weeks 4 and 6, and for ADVANCE, the ECG were collected at week 14 and week 26. The QTC intervals we used were the Federica corrected QTC, also known as QTCF. For this exposure response model, we use a previously developed population PK model to predict individual pimavanserin concentrations at the time of QT measurements. The model predicted concentrations we use as an exposure measures as an input in the model. The covariate analysis in this study included the assessment of age, sex, baseline weight, race, and background antipsychotic medication. Model was validated using prediction corrected visual predictive check methodology. In the analysis data set, we included 2,080 records from 737 patients, and around half of them were dosed with pimavanserin, and the other half were on placebo. And the range of ECG collected were from week 1 all the way to, from randomization all the way to 28 weeks. And for patients treated with pimavanserin, the majority of them received 34 milligram, followed by 20 milligram, and only a handful received 10 milligram doses of pimavanserin. And as a population average, the patients averaged at 37 years old, predominantly male, with a median weight of 81 kilo. and their baseline QTCF were measured at 399 milliseconds. The bottom of the table shows a distribution of the background antipsychotics that they were on in these patients. So we plotted the change in QTCF from the baseline, also known as the delta QTCF, versus the model predicted pimavanserin concentration. And in the plot on the left, we generated a trend line to represent the central tendency of the relationship. And we can see that as the pimavanserin concentration increases, the delta QTCF also increases. On the right, we presented the same information, but we colored the data with different background antipsychotic medication. In this plot, we can see that there are no difference. The various antipsychotic background medication was scattered evenly, indicating that there's no difference between these antipsychotics in terms of delta QTC increase. Oops. So after this exercise, we found that a linear concentration QTCF model best fit the observed data. This model was parameterized in several terms: a baseline QTC interval term, a slope of the concentration effect, a weak effect, and an additive shift in female sex. During the covariate analysis, we found that female sex was a significant predictor of the baseline QTCF, with females having 11.7 millisecond longer baseline QTCF than males. In the figure on the right, we show the observed data overlaid with model prediction, and the solid line represents the median population mean prediction, with the shaded region, which is the 90% prediction intervals. So we did another exercise where we used the numbers from a separate analysis, where we found the steady state maximum concentration of pimavanserin following a 34 milligram daily regimen, and that steady state Cmax was found to be 60.4 nanogram per ml. And with our final model, we predicted that at this Cmax concentration, QTCF was predicted to increase a mean of 5 milliseconds, with 90% confidence interval of 3.3 to 6.6 milliseconds. To visualize this, we drew a vertical line on the plot in the right, and you can see that and the horizontal line here represent a 10 milligram regulatory concern of QTCF increase. As you can see here in the plot, oops, can you still see my screen? Did I hit something wrong?
Yeah, we can't see the slides.
Sorry, 1 second. I think I hit stop sharing.
That's good.
All right, let's continue. So as we can see there in this plot, that both the median and the upper 90% confidence interval were below this 10 millisecond regulatory concern threshold. So this is an indication that this drug does not cause clinically significant QT prolongation based on the data that we have. So from this modeling exercise, we can conclude that the selected antipsychotic medication did not make any difference in the effect of pimavanserin on QTCF. And the observed data agrees with this conclusion. We also noted that both of these clinical trials, Enhanced and Advanced, they were not designed for thorough QT analysis, and our results were based on modeling and simulation of the observed data. And lastly, our findings are consistent with the previous result of the QTC interval increase of 5 milliseconds for Pimavanserin. And that concludes my slides.
Well, thank you, Hannah. Looks like we don't have any questions from the audience right at the moment. I was just going to ask you whether, or maybe you could comment on whether this type of analysis could be applied earlier in an earlier phase of drug development.
Sure. I think this can definitely be applied to a much earlier stage of the drug development. In fact, in a few years ago, when the FDA published the QTC concentration QTC analysis white paper, they encouraged the sponsor to start looking into QTCF or QT prolongation starting at phase 1. And they presented a standard model that we can follow to use QT or ECG information.
Okay. So could you just maybe comment further, since we have a little bit of time?
Sure. This study is not typical of the study design of this data that I presented here does not fall into a typical thorough QT concentration if data, or the data that's collected here did not match the requirements that were suggested in the white paper. However, we just had to utilize the data that was available and just look at the QT effect in the special population while there are multiple antipsychotics, because there weren't previous study done on this type of combination drug and people on multiple antipsychotics.
Okay, I see. All righty, well, we're down to about 1 minute left. I just wanted to remind everyone that there will be a panel discussion after the track is over at 2:15. So if you have questions that you're holding back on now, please feel free to bring them to the panel discussion. So thank everyone for joining us. Just to let you know, the webinar is being recorded for playback and will be available on the Simulations Plus website and YouTube channel. So this will conclude the session, and thank you again for coming.
Thank you.
Thank you, Hannah.